My name is Molly, and I work as a member advocate at NoCD. As a member advocate, I walk alongside other members as they are going through therapy. So I am somebody who has OCD as well, and I have gone through NoCD therapy myself. A lot of other members that I speak to who are just getting started on their recovery journey do express this fear of, what if I don't actually have OCD? What if these thoughts are real? What if these thoughts are who I am? And I do tell them quite often that I speak to a lot of people with those thoughts, that it is a pretty common fear when starting therapy, especially if you've not been in OCD specific treatment before. For many years, I was living with anxiety and OCD, and I did not know that that's what I was suffering with. I very much doubted that that's what I was dealing with as well. OCD is nicknamed the doubting disorder, and it really will have you doubting anything and everything around you. Since I had been living with OCD for so many years, I didn't think that things could get any worse, and I figured that trying therapy, at least going to that first appointment, meeting with somebody, learning more about the disorder might be worth a shot. I reached out to NoCD and got connected with a therapist. But in the time between scheduling an appointment and meeting with my therapist, I really doubted that this was the right treatment for me. I had fears that if my therapist told me it wasn't OCD and that these thoughts were just a part of who I am, that I would spend the rest of my life miserable. I really did think that, a part of me really believed that these thoughts might be who I am and the things that I care about in the world. And that was really scary. I didn't think I would be able to live a happy life. When I had my first therapy appointment with my NoCD therapist, she asked me a lot of questions to get to know me and my symptoms and my experiences a little bit better. And in talking through what I have gone through and the different things that I was experiencing, she did diagnose me with OCD. Receiving that diagnosis really answered a lot of questions from my childhood and things that I didn't understand growing up that made a lot more sense once I had an official diagnosis. When you meet with your NoCD therapist, they are extremely understanding and non-judgmental. They go through extensive training in how to work with individuals with OCD, and although it is a very common fear that this might not be OCD and these thoughts might not be OCD thoughts, there are times where somebody is not diagnosed with OCD, and in that case, your therapist will work with you to try to find the best care and the best treatment for you. If you are suffering or experiencing OCD thoughts or symptoms and you think this might be OCD, I really would encourage you to reach out to us at NoCD. It can be really scary, and even making that first phone call to express interest in therapy can be really scary, but I think it is important to keep in mind that there are so many other people out there who have gone through similar experiences, who really do get it, who talk about these things day in and day out, and who are here for you to walk alongside you and help make your future even better.